Welcome back to another episode of Rehab Now with consultant, physiatrist, rehabilitation, medical doctor, Dr. Paula Dawson. Hi, Doc.
Hi, Alicia. Hi, listeners.
Yes. I'm your host, Alicia Taylor. Today we have someone special in studio. We had to call her back. Yeah, man, it's not the first time she's here. She is a physiotherapist, one of the physiotherapists at the Rehabilitation Institute of the Caribbean. Her name is Tashara. What's up, Tashara?
Hi, Alyssa.
Yeah, man.
Hi, listeners.
That's right.
Hi, Dr. Dawson.
Whoa, everybody gets a hi.
It's nice to be back.
It's nice to have you back. But on my show, me welcome her back.
You know what? I'm just going to continue. Remember to check out our socials on Instagram. It's Rehab Institute Caribbean, Dr. Paula Dawson, Alicia Taylor Music. And on Facebook, Rehabilitation Institute of the Caribbean. And our website is rehabcaribbean.com. Now, this week, we're going to be talking about, let me drop my energy right now. We're going to be talking about arthritis. Specifically,
Alicia's favorite.
Specifically, rheumatoid arthritis. And I'm not very thrilled about it, but, we're here, so let's talk about it, right? Doc?
Rheumatoid arthritis.
I mean, I know arthritis so well. So I'm not even going to ask you to tell us what arthritis is. Actually, tell us, because some persons who are listening and they don't know, they don't come to the school of rehab now. Yeah, man.
Okay.
So
you know why I like that? Because I'm going to go down into some perhaps Latin foundation. Arthro, A-R-T-H, deals with joints.
all right.
So you have arthralgia, joint pain. Arthritis, inflammation in the joint. Arthroscopy, looking in the joint with a camera by the orthopedic surgeon, not orthopedic surgeon.
So the one of them are the arth family.
The arth.
Okay.
The arthritis. And so we're talking about arthritis. It's inflammation of the joint. I'm glad you started off there, Alicia. Why? Because inflammation of the joint can be degenerative, overuse, like when you have a lot of weight on you, or you run whole heap, or you injure your biomechanical breakdown of the cartilage. It can be inflammatory, which is secondary to your immune system attacking yourself, autoimmune, like rheumatoid arthritis. It can be from psoriasis, psoriatic arthritis, when you have psoriasis of the skin.
Yeah.
It can be ankylosing spondylitis, which is another type of arthritis. It can be septic, meaning an infection, septic arthritis. So it can be gouty arthritis, where you have gout crystal in the joint. So it's arthritis, inflammation of the joint. And so today, as you said, we're going to be talking about rheumatoid arthritis. And we're going to touch on your favorite osteo.
Can't wait.
Arthritis.
So excited about this topic. You should see me smiling in the studio, really.
Yes.
So, but tell me, so what is rheumatoid arthritis? So that's what we're talking about.
So rheuma, R-H-E-U-M, rheuma, it means with autoimmune, right? So the rheumatologist is a medical specialist that will deal with inflammatory conditions in the body, where the body's immune system is attacking itself. So a rheumatologist will deal with lupus.
Yes, I know
Right.
that. I know that.
Collagen vascular disease, and so rheumatoid arthritis is where you have an autoimmune issue where the body mistakes the joint as non-self and it attacks it.
No, missed that one. Let's go again. Say it again, slowly.
All right. So in the body, and the immune system is that part of the body that is the defense system. So if you have virus come in the body, the virus will have an antigen. I'm sure you remember antigen from COVID.
Of course.
So the antigen is that marker on the outside of the cell that defines it. But the body knows its own antigen.
Yeah.
However, there's a time when there's a mistake in the immune system and it picks up its own body as non-self. And it attacks it, so it makes antibodies against it. It can happen to the heart. You can have pericarditis, myocarditis. You can have it in the kidney, right? Nephritis. You can have it a lot of places. So immune, right? So autoimmune disease are diseases that can run in the family, and we'll talk about some of the other causes. But it's where your body automatically, its immune system is affecting itself. And in this case, it's your joints.
Jesus.
Primarily joints. So all the joints. Particularly, more commonly they start with the hands and the knees and the elbows and the hip.
All right. Okay. Sorry, got it now.
Yes.
Still upset, but got it. So,
Yes.
what are some of the like warning signs of, rheumatoid arthritis?
So rheumatoid arthritis symptoms. So usually you have pain and stiffness that lasts more than an hour, 2 hours in the morning. But it's usually symmetrical, and that's the thing with rheumatoid arthritis as opposed to osteo. It's symmetrical. If it's the right side, the left side has it. Like osteoarthritis, it's a symmetrical disease. And so with osteoarthritis, it can just be one knee because that knee, one leg shorter than the other, or you've had an injury, or one knee not more than the other, so the biomechanics.
One is just more dominant.
Yes, when you have more dominant strength on one side of the body. But with rheumatoid, it's symmetrical, and it's usually morning stiffness that lasts like up to an hour or
And
two.
it can be any part of the body.
Usually it starts with the fingers.
Okay.
So rheumatology kind of, you start with rheumatoid arthritis, it starts in the fingers, but it can be any joint. It can certainly be any joint. And so patients with rheumatoid arthritis, they complain of morning stiffness and pain in the
Morning
joint.
sickness, oh boy.
Morning stiffness.
Morning sickness. Anyway,
Morning stiffness in the joints that lasts about an hour or two. When you wake up in the morning.
Just stiffness for 1 hour straight.
Yeah. Like, so you get up and you can't, take up your toothbrush. When you wake up, you're stiff.
Yeah,
Usually when I wake up, I look like I have chikungunya. Walking like every morning, my left ankle tight. And then after like 3-4 steps, it's gone. You don't have that. Tashara, you have that?
Young and fit, that.
Oh, yes, my girl. Alicia, are you?
No, I'm not even looking at Tashara right now. Of course, everybody have stiffness when young and fit. But so if me wake up with, what I want to know, similar questions I've been asking. Some of these symptoms can present as something else. How do I know that? Arthritis, pain.
Rheumatoid.
Rheumatoid arthritis I'm having, because the one that you said, it's persistent for like an hour.
Or two.
Jesus. So that's how you know.
And it's symmetrical.
Yeah. But so okay. How do I know that it's symmetrical? Because if me, so
Maybe
I'm
two sides.
feeling
Symmetrical mean two sides, right and left.
I thought you said it's happening on this side, but you're feeling it on the other side.
Oh no, sorry. Symmetrical meaning
It's in both hands, both knees.
So the right wrist, the left wrist, the right middle finger, the left middle finger. It's symmetrical meaning equal on both sides. The symptoms that you feel. And so what are the symptoms?
So yes, you have even swelling in the joints, a lot of fever. Sometimes I say a fever in the
your
joint.
joint, it feel hot, no?
Feel hot
warm.
because of the inflammation that's going on there. And the stiffness, pain, those are the marker symptoms of RA. So another thing, now to confirm it, it's usually done when you go to the doctor and they run certain tests and they pick up like
Rheumatoid factors.
the factors, yes, in your blood, and that actually confirms.
Oh,
that
then
it's
they do
RA.
a blood test.
So there's a blood test.
So you can see arthritis.
You can diagnose it based on the markers. And so remember I told you that you're attacking your body. So when you attack your body, you get these markers that show up. So in addition to the pain and swelling and tenderness and have it on the right and the left, you have some constitution symptoms as well, systemic. So you can be fatigued. And you can have generalized weakness. Because it's autoimmune, your body fighting. So the immune system kind of overworked.
Yeah.
So you kind of just
really
Lousy and
you feel very lousy, etc. And so, the doctor can't really tell. However, if neglect over time and you don't go to the doctor, there are certain features that Tashara is going to tell you about. That there's a phenotype, they call it, where the joints, we call it ulnar shift.
Yes,
Where
so in the MCP, so the metacarpal phalanges, they just start to shift in the direction of your thumb. So everything just starts shifting.
Why do I shift?
Because of the immune system attacking the cartilage and everything just shifts.
Right.
And then you even get a marker in the finger called a boutonniere. So the thumb is just like really bendy and it's in a lot of extension and the hands deform.
Right. So you get the definite. So with the inflammation in the joints, as Tashara said, you get that drift where the hand just look like it's windswept to one side, and then your knuckles start get bigger, fat, and disfigured. And so you have two different types. You can get, as she said, you can get the swan's neck where the joints.
I have seen people with them hands looking like
Right.
that. And I was wondering, I thought that maybe it was something in them genes. I didn't know that.
It actually can be genetic.
Absolutely.
Okay.
Yes.
Talk to me
So
now.
rheumatoid arthritis, it has been.
It is a genetic thing?
It
Can be
genetic.
certainly can be.
Yeah.
Right. So and that we talk about the risk factors. You know, who are the people that will get it?
Yeah.
So persons that get it now who have, or persons with even just immune compromised people can get rheumatoid arthritis. And as I say, it is also a genetic thing, so it can be coming down from the family line.
An inherited trait. There's a
Inherited.
genes, the HLA genes that comes down, and you can get it.
And then sometimes the body just decides,
Just switch.
Just start fighting itself.
Oh, and also too, you know, with the risk factors, you look at the gender. More common in women
It is?
than men.
it is.
Of course it is.
And older than 60 years old. And there's some other risk factors, believe it or not. Early life exposure. If your parents smoke, if you're in a house where people smoke, that's early life experiences. Yeah. And also, interestingly, this one is gonna blow your mind.
Talk to me.
If you have not had a live birth, meaning if you've not delivered as a woman, meaning if you don't have no babies, you're at a higher risk than people who have delivered.
All right, make we talk about that one, you know, because people are going to want to hear.
Yeah.
I
The risk factor, that was interesting.
I want to hear that.
Yes.
Women, so if you've never actually had a child or you've never done live birth.
Live birth. Right. And so this is when how they do it, you know, they have patients with rheumatoid, and it's science, it's research, and they look at the factors. So people who would have had rheumatoid, they look at the percentage of who would have had live birth and who would not have had live birth, and they'll see that compared to regular population, more of them never had live births.
That is interesting.
It is interesting. But you know what? There's a catch-22 to that, you know, because if you start early having pain, you know, you don't really have time to have children. So it might be the other way around where the pain, this is just me, Paula Dawson saying that's not what's in the book, you know. So if you have, always have pain and weakness and tiredness, you know, you may not have the opportunity to explore having your own children. And so you find that might really be the cause of that association. You know, that's just my inference. But when you look at the literature, it will tell you, you know, the history of live birth.
Okay. Great. I like that. You know what? We have to take a break.
Yes.
I'm very excited. No, I am not. We will take a break and come back and talk about rheumatoid arthritis. Stay with us.
What a switch.
Welcome back to Rehab. Now, if you're just joining us, we're talking about rheumatoid arthritis. We have Dr. Paula Dawson and Tashara in studio.
Hi.
Oh, don't sound so excited, guys, really.
Hi.
And so we're talking about the risk factors. I don't know which one of you want to take this one, but the risk factors, you know, with rheumatoid arthritis.
Okay, so I'll take it.
Okay.
Tashara speaking. Hi,
Go,
guys.
Tashara.
So, there are quite a few risk factors with RE. So, one, being a female, that's a risk factor.
That's sad.
It's very sad.
Yeah,
But
2 to 3 times more than male.
yeah.
2 to 3 times.
Absolutely.
God, that's depressing.
So-
But we have other benefits though.
Talk to me.
Right? So, exposure to silica dust. So, that's occupational dust. So, depending on the kind of work, like in certain factories, they have a lot of exposure to silica. Air pollution.
Arthritis, whatever?
Yes.
But remember it's the
this is
immune system.
immune.
You trigger the immune system.
So this is not your regular arthritis. High sodium, high sodium consumption, high iron consumption, low vitamin D intake, smoking, obesity, and low socioeconomic status. So those who just cannot afford a good quality of life.
Right.
So those are a few of the risk factors.
Your diet?
Your diet,
Yeah,
definitely.
man, definitely.
So that's why we say high sodium
And the low vitamin
and the
D.
low vitamin D intake.
And obesity as well.
Yeah.
Yeah, because right.
On obesity as well. But then you hear this now, how can you decrease in risk factors? Right?
So the decrease now, we know, for instance, as we list these, you can combat them. So with the obesity, you lose weight.
Yeah.
You increase your vitamin D intake.
Yeah.
You decrease your sodium intake. You take a lot of fish and omega-3 fatty acid. Decrease your alcohol intake. You're healthy.
Stop smoking.
Moderate alcohol is protective. Moderate alcohol.
Right.
My girlfriend Deborah Taylor is going to say, yes, alcohol works, but overindulgent.
Yeah, of course.
So just a healthy diet.
Yes.
Oral contraceptives.
Yes.
I'm sorry, say that one again for the listeners. What?
Oral contraceptive
Would that
reduces
work?
the risk.
I don't even know how that makes sense.
I actually don't know, but if I were to postulate, I would say because it stabilizes your hormone and it helps with immune system, because it's immune regulation.
That makes sense.
You understand? But another risk factor is breastfeeding. Decreases risk factor.
Yes!
Yes.
I was a breastfeeding mommy.
So then that kind of debunk what I said earlier about live birth. And not it, which so it's the breastfeeding after the live birth that actually helps.
Makes sense.
Makes a lot of sense.
Yes.
Interesting.
But you know what? I just want to mention a kind of a rheumatological kind of a thing. A lot of times, some patients may even have the jointy achiness when they eat certain things. Like wheat, when I eat a lot of whole wheat, when I wake up in the morning, my knuckles hurt. Some people it's gluten allergy, some people it's tomato, So you have to know what
your body.
You have to know your body. And it's just that, for example, the wheat, like when I eat wheat, you get a lot more mucus. It's your body. It's like the inflammation. So this inflammation can be in your joint, right? And so, rheumatoid arthritis, the question is, with all of these, risk factors, how do you really know that you have it?
Yeah, how do you make a diagnosis?
Well, for those patients who are in the boondocks, or, poor socioeconomic and they can't go to the doctor, you get the ulnar drift of the hand. So you get the fingers are kind of drifting to the little finger side, the ulnar drift side. And however, you go to the doctor, we can do x-rays. The x-rays will show the joint thickening, you have those nodules on x-ray. But the thing that really does it, the rheumatologist, I'm not a rheumatologist, but us as doctors will order blood tests. We do a collagen vascular screen. So we look at your rheumatoid factor, your anti-nuclear antibody, your ESR, your erythrocyte sedimentary rate, the CRP, all of these things. Anti-Ro, anti-La. It sounds like you're singing.
Anti-Ro, anti-La. Yeah, that's why I'm anti them, It's like anti-Ro, anti-La. You know what I'm saying?
These are the, and it's not antis, A-N-T-I. It's like,
sorry.
Yes, it's like the DNA, anti-DNA.
Got it.
Jamaican enough.
Got it. So anti, we call it.
Anti-Ro, anti-La. So you're really looking at the immunological markers in the blood. All right. And so some of these are similar to the immunological markers you would see in like lupus, as well as other autoimmune like scleroderma and some other things. But for us, the inflammation is in the
joints.
The joints.
That's where it's attacking.
Yeah.
Okay, good. So so great. So we've gone through the risk factors and we've gone through the diagnosis. At this point, we want to know how we treat rheumatoid arthritis.
Right.
I don't know if it's different from just the other types of arthritis, because apparently you have arthritis stuff everywhere in your body. You know?
See, this one is important because the immune system, you have to treat the immune system first. Even before you get to us as rehab specialists, you have to treat, they call them DMARDs, disease-modifying anti-rheumatoid drugs, DMARDs. And so these drugs are to stop the immune system from attacking your body. And you have different types. You have a heap of them. And they evolve over time. Some of them might be, some people use steroids. It's a lot of anti-rheumatological drugs, DMARD, disease-modifying, drugs. Even one of the drugs. What was the name of that drug during COVID that they were using?
I remember that, you know.
I know what you're talking, but it's not in my brain right now.
Hydrochlorothiazide.
Yes, that one.
Yeah,
Oh,
so we
that's
use
the
that.
one.
So what happened during, I think, the United States president might
Yes.
have mentioned
Yeah,
that you
he
can
was a big
use,
fan.
right. And so our poor rheumatoid
Hey.
patients, my rheumatoid patients couldn't even find the drug, the hydrochlorothiazide, which is really important to help inflammation. And remember, you know, in the COVID episode, where, you know, we talk about inflammation of the joint, and which is why they thought that would help the inflammation in
Okay. So,
the COVID patients.
okay. So I have a question. You know, like you have. Okay, so this is an autoimmune problem, which means, well, I would think it means that other areas in the body being affected, right? Autoimmune. So is it a case where you would have to work with other specialists
Definitely. It's a multi-team
while you
approach.
work? Okay, that means you, okay, still, okay,
Yes.
good.
Yeah, absolutely. And as with a collagen vascular autoimmune process, you have the spectrum of how many different organs in the body or systems are affected. So you have, for rheumatoid arthritis, it's affecting the joints, arthritis. Now you have something called juvenile rheumatoid arthritis.
Juvenile.
Yes, which is, oh my goodness, it's
in a
such
young stage.
it is very sad. It is one of those rheumatoid. When I researched it, it broke my heart. So rheumatoid or juvenile rheumatoid arthritis is not that the children only have arthritis in the joint.
It's for
It affects children, but it affects their kidneys. It affects their spine. It affects their organs. It affects their heart. It actually. It's always called juvenile rheumatoid arthritis. Just I think when you go talk to the rheumatologist, it's a big umbrella term that they use for different types of inflammatory conditions in children. So not just the joints. And so, you know, some of these kids, they have it in their neck and they have to wear a neck brace, and it affects the spinal cord, and then they have neurological problems. It is.
And they have pain.
They have a lot
Chronic
of pain.
Chronic pain.
And then they function, you know, what happens with when you have arthritis and swelling and pain, you function.
You know the function.
Yeah,
What
your
kind
quality
function
of
would
life
you
is
have?
fairly poor.
And with decreased quality of life, you get deconditioning.
And this is where now physical therapy comes in play.
We're gonna smile.
Because RA is a progressive disease, right?
What does that mean for those
So-
who don't know?
It won't go away.
Oh my.
Unfortunately, it won't go away. But this is now where the multi-team approach comes in. So from the pharmacist, Dr. Dawson,
The
the rheumatologist, the nutritionist, the physiotherapist, the occupational, the psychologist.
It's tough, yeah, man.
Oh,
It's depressive. It's hard.
That
Yes.
would be difficult.
So the physiotherapist now is the one who is going to implement exercise programs to maintain the joint integrity. So don't let it get worse.
And the joint integrity, I like that.
Yes. Strengthen the muscles around the joint. And with that exercise, it actually helps to boost their energy because it releases the happy chemicals in them, and it helps to decrease that pain. And with the strong muscles, you know, you feel more confident in doing your activities of daily living. And this is now why the physiotherapists are here.
So
And we play a great part in a person with rheumatoid arthritis.
Very important.
Life.
So it doesn't go away, but it gets
Unfortunately.
better, but it can get better. I'm asking.
It
It
can.
It can.
It can
And
be
when
managed.
We manage
Can
it.
be
We
managed.
slow down the progression.
Oh.
And so management, the important part of management is the medical management, the medicine, the pills, the injections. You know, one of the drugs that they even use is methotrexate, which is kind of it's a anti-cancer drug. You just to kind of quiet that, you know, inflammatory process, right? But once the medical management is there and the disease, because sometimes, you know, Tashara is treating a patient and they're going on well, and then what happened? They have a flare. It just, the inflammation just
Yeah.
gets acute.
They can have flare-ups just by the simplest thing, and
So
yeah,
this is the complication.
So it's remember, it's the
training.
immune system, you know. So if the immune system say, hey, today I'm going to get up and attack more
I'm
joints.
tired, so I'm gonna attack some joints today.
So stress, smoking, anxiety, other illnesses. Food, yeah.
Certain foods can just cause a flare up. Yeah.
This is depressing bad.
But you see, the good thing is quality of life.
Yes.
Quality of life with a medical management, guys. Don't make make you feel so sad.
I hate arthritis.
You know, but the good thing, that's what medicine is about. You know, imagine days ago, back in like AD, enough, or BC,
when we
enough.
never have it. Really.
Although them did have some bush medicine still.
Them cook up them bush and thing for true, yeah. For the pain and stuff.
And they knew you had the medical doctors then, but you know it's manageable. You have patients live successful lives. You know, compliance, stress management.
Definitely. The diet, all of these things. You just have to modify your lifestyle.
Stop smoking. You know, lose weight,
Yeah.
eat healthily. You know, you self-manage, make sure you're compliant with your medication.
I like them advice here. Keep them coming.
Yes.
keep them
Physically
coming.
active, you know, whatever.
Yeah, keep active.
Yeah.
Keeping active. Even though sometimes being active can exacerbate it. You might have a flare up, but you know, you just control it again and you go back to the drawing board and we start again and we attack it.
Hear
And
that?
it has to be done under the supervision of the physical therapist
Yes.
and your medical doctor. You can't just go out. So you know, when you go come to Tashara or the guys at Rehab to the Caribbean, they will guide you.
With a proper exercise prescription.
Yeah.
I like that.
Yeah.
Thank you, guys. Thank you so much. That's all we have time for. Thank you for joining us today on Rehab Now. Thank you to the listeners and Power 106 show producers. Rehabilitation Institute. Rehab Now is brought to you by the Rehabilitation Institute of the Caribbean, Winchester, MRI, Immune Active Denk, and Almighty Studios. See you guys next week, same time, same place. Blessings.
Blessings.
Mom.
Bye. Bye, Mom. I love it.